Good day, everyone. Please allow me first to introduce myself. My name is Iani Chihaia, and I'm with the Romanian feed industry for the past 25 years. Starting with 2018, I'm part of the European Feed Manufacturers Federation, African Swine Fever Task Force, and working together with my colleagues from the EU to combat the ASF spread and impact on the European feed and swine industries. African swine fever is highly contagious virus that cause high death rates in pigs and devastated the swine industry from several Asian and European countries during the past 2-3 years. Because of the African swine fever, has the potential to dramatically disrupt and change the global protein production. This problem deserves the attention of all the animal protein production stakeholders, including the feed manufacturers. The goal of the presentation today is to increase the awareness among the feed manufacturers from Southeast Asia regarding the African swine fever virus risk factors and the impact on the feed industry and what actions to be taken in order to minimize the spread of the virus. African swine fever is a challenge for the whole world simply because has the potential to dramatically disrupt and change the global protein production, consumption, and meat trade flows. In order to understand the spread of the disease, of this terrible disease, I will compare with a fire. Disease outbreaks are a bit like the fires. The virus is the flame. The susceptible people are the fuel. The ongoing COVID-19 and African swine fever follows the same patterns as a fire in a wood. African swine fever is the biggest threat to the world swine industry and indeed should have significant impact on the feed industry. And at this stage, the situation is the following. More than 80% of the wild pig population is impacted by this terrible disease, and the disease is expanded, is spread on 3 continents, is present in more than 60 countries, and evolves through different epidemiologic scenarios. The latest outbreaks of African swine fever were reported in Greece in April 2020, and more recently, about a month ago, in India. The disease was first reported in 1921 in Africa, and only 13 countries succeeded to eliminate the disease after fighting for as long as 36 years. In Europe, the disease entered in 2007 through the port of Poti in Georgia, and quickly the disease spread into Russia and to the Baltics, to Poland, to Czech Republic, to Hungary, to Romania, to Belgium, as mentioned recently more in Greece. And in all this time, the only country succeeding to eradicate African swine fever was Czech Republic. As you can see from the slide, there are 2 different epidemiologic scenarios. The first one with the red dots, as you can see into the left slide, there are outbreaks of ASF in domestic pigs, and with the blue dots, there are outbreaks of African swine fever in the wild boars. The disease is moving from east to the west part of the continent, and it's going to take years until we reach the border of the continent. As reported in the EU and non-EU countries, the disease has different evolving patterns, as mentioned before. First is in the wild boars, which are typical for Belgium, Czech, Hungary, is 100% reported only in wild boars. while in the Baltics and to the Southeast European countries, the African swine fever got into the domestic pigs herds, especially into the small farms belonging to the villagers, because the percentage of the highest percentage of the pigs, of the domestic pigs, belongs to the small farmers. So, what is the importance of African swine fever for the food of the world? African swine fever threatens a major food source and $1 billion of international trade. African swine fever, besides damaging the production losses, it can severely affect the trading condition with subsequent export losses of any country. Collateral damages includes several industries and human activities like food production, drug manufacturing, farming, feed ingredients trading. African swine fever has devastated for the past 2 years the Chinese swine industry, and despite the low official reported cases of African swine fever and robust recovery efforts in the second half of 2019, overall the swine production and the slaughter will remain depressed into 2020. Pork is the main source of protein for the human diets. About 40% of the pork, of the protein, is coming from the pork, while 33% is supplied in the human diets by the chickens, and 21% is supplied by beef. In terms of production, the largest share in production of the pork is China, with 50% of the pork produced prior African swine fever outbreaks, followed by European Union with 21%, and with just 10% for the United States. In terms of global trade of the pork meat, prior the African swine fever, Germany was the number one exporter, followed by USA, Spain, Denmark, and Canada. For the European Union, the pork is an important export, and is over 60% of the total meat exports of the EU bloc. African swine fever is an exceptional event at the World Animal Health Organization, OIE. OIE was created in 1924 by 28 countries, and today has 182 members out of 195 countries in total. And the general mandate of the OIE is to improve animal health worldwide. African swine fever is a notifiable disease. A notifiable disease is the kind of disease you are legally obliged to report to the national vet authority, and if confirmed, this has to be reported to OIE. If a notifiable disease is confirmed, action will be taken at the national level, following activities that could spread the disease. May be banned, such hunting, animal transportation, and exports of pork. The impact of notification of African swine fever presence in a country will have immediate effect in closing the borders to trade, and this is a financial risk as well. African swine fever is a huge risk for large pork producers like Germany, USA, Spain, Denmark, and Holland, and a border closing for trade will be a disaster for all the exporting countries. Understanding the African swine fever pathogen, the virus, the disease risk factors, and the transmission cycles are essential in preventing, combating, and eradicating the disease. African swine fever virus is a DNA virus, is complicated with distinctive morphology, is probably the largest virus we have on the earth, and is a very tough virus. The host is the porcine macrophage, and insects such the soft tick insects, which are present into the Western Europe in countries like Spain, Portugal. A natural reservoir of African swine fever is the wild boar, which is widely spread from Southeast Asia till the American continent. African swine fever is a very resistant virus in the environment. In the liquid manure, the virus should survive for 112 days. In feces, should survive 159 days. In pig blood, should survive 112 days. And in the contaminated soil, for 98 days. The virus should survive in uncooked pork for 6 months, in dry salt ham in 104 days, and in frozen meat should survive up to 3 years. The transmission cycle, there are several transmission cycles of the African swine fever. One is the backyard, and this is more from the animal to animal, from nose to nose. The other one is through a catering cycle, which involves feeding food scraps or food remainings from cruise vessels, from passengers, airline, and those are fed to the farms. It's a wildlife cycle which spread the virus through the wild boar and through the wild animals and birds, or through the ticks to the insects, and is also a commercial farm cycle where the virus might be introduced by the humans or by transportation, by trucks, and so on. African swine fever virus should be transmitted via compound feed, ingredients, and water. And in this regard, the science of viral transmission through feed and feedstuffs is relatively young. But recent studies from Kansas State University has shown that the theoretical ability for pathogenic swine viruses to survive transport in imported feedstuffs and established the infectious dose of African swine fever when consumed naturally in liquid or in feed. There are several gaps in terms of knowledge in the potential African swine fever transmission with origin in contaminated feed and feed ingredients. We don't know much about the survival of the virus in the feed components or in the feed compounds. We don't know much about the African transmission through the insects and what are the roles of different arthropods and flies like vectors. We don't know, and there are not yet available methods and protocols for ASF surveillance. And there is still a lack of communication in terms of method and effectiveness of communicating the African swine fever outbreaks, the epidemiology, and how to increase compliance with the control measures. And this deserves the attention of the scientists, of the feed industry, and the governmental authorities. What we can learn from the past incidents, from the past transboundary and emerging disease impacting the feed industries in our countries. There are comparison and previous experiences with other pathogens, which should help the feed industry to understand what to expect from a potential African swine fever infection contamination in a feed mill. In this regard, in 2013, a massive outbreak of an unrelated but equally deadly pathogen, the porcine epidemic diarrhea virus, killed more than 10% of the US pig herd. Between killings and disinfecting farms and compensating farmers, the US lost about $2 billion. The source of the contamination proved to be woven plastic bags that are used to move pig feed ingredients and additives around the world. Once PEDV was introduced or is introduced into a swine feed manufacturing facility, there is a significant dissemination of the viral RNA through the surfaces of the equipment and making the contamination and viral elimination a challenge. 1 gram of feces from an acutely PEDV infected pig should contaminate up to 500 tons of feed, with each gram of being infectious. The Kansas State study from 2018 was the first research demonstrated the ability of certain feed ingredients to support the viral survival of African swine fever virus under laboratory conditions. The study found out that the holding time for the feedstuffs may reduce the risk of African swine fever transmission. As a result, the study proved that after 78 days, it's safe to use packed feedstuffs produced and handled in sealed or secure bags and or containers. And for bulk feeds like soybean meal and DDGS, the use is safest after 286 days after the ingredient was manufactured. This is long, but this should be a strategy for the industry to avoid contamination with this virus. In spite of the problems, the business has to continue in the feed industry as usual. And how to handle this, how to deal with this, is to continuously update the biosecurity and to implement the biosecurity procedures in the feed industry. This is the only way, especially because there is no vaccine for this disease, and most probably a vaccine for African swine fever will not be available any soon. But the feed mill biosecurity is an evolving concept that involves many people in a complex system. The design of the feed mill and procedures help the feed manufacturing to minimize the risk of contamination. In this regard, once the materials enter the feed mill, the contact with the pathogen is minimized. As we know, the storage facilities, the bins are closed, the feed is thermally treated, and the transport and storage of the feed is always secure in the feed industry, and the moisture, which is maximum 12%, is unfavorable for African swine fever development. Each industry is having biosecurity protocols, and all of them are very good. But as said, feed mill biosecurity is an evolving concept and is like a live document and has to be updated all the time. Problems are detected or new challenges are detected. The number one goal for biosecurity program is to prevent contamination from occurring. European feed industry is having developed a recommendation for a biosecurity plan. Belgium Feed Association is having a very good biosecurity plan, while the American Feed Industry Association and Canada has very good plans as well. And they are all available on the sites of the feed associations. What the European Feed Manufacturers Association did last year, they developed some recommendations for a development of a biosecurity plan for the feed industry in the European Union. A biosecurity plan has to be science-based and drafted by a team of experts. Has to cover from feed ingredients to intake and to farm and to visitors. Has to foresee effective training and be subject to frequent auditing. The plan has to be reviewed, maintained, and adapted to new practices. has to include minimum requirements regarding interactions with farms, and to consider also that any pathogen is a risk for the personnel too. The purchase of the ingredients has to be from clearly identified sources and reputable suppliers. The risk assessment has to identify the risk factors. There must be an existing procedure for mitigation. Any feed producer has to have an operational HACCP plan, and the plan has to be effective implemented to monitor the pathogen. And always there must be in place contingency measures in case of detection of the pathogen. Another type of measures has to take into account to keep the feed mill and surroundings clean, to control the pests and rodents, to establish hygiene requirements for the staff and visitors and their vehicles, to establish hygiene procedures for delivery trucks, to restrict the visits of the animal barns by the feed mill company employees, to comply with on-farm biosecurity in farms where plants exist, to avoid trucks and drivers in the clean zone of the farm, to use unloading equipments as far as possible from the animal houses, to establish clear rules for the use of cleaning, disinfection of the vehicles, to keep a detailed diary deliveries to each individual farm. Not in the last, the feed industry has to implement a decision tree matrix to minimize the viral transmission risk from the feed ingredient. This tree matrix was elaborated by the pork checkoff from the United States, and the feed ingredient has to go through different evaluation steps in order to avoid the risk and to establish the type of the risk. If the ingredient has a low risk, minor risk, or moderate risk. And in case of there is a real risk, the supplier and the ingredient has to be rejected. African swine fever is here to stay for the next decades. As such, we have to hope as a feed industry for the best, but to prepare for the worst case scenario. The takeaway messages are the pork is a major source of our food, and African swine fever has the potential to dramatically disrupt and change the global protein production, consumption, and meat trade flows. African swine fever is a very patient and very resistant virus, remains viable for long periods and can multiply in different vectors. And remember, African swine fever is a notifiable disease. And once the disease is reported, animals cannot be moved, exports of pork are banned, and the losses are huge. Human inattention remains the key driving factor of this epidemic. Our vast networks of food production, distribution, consumption, and waste disposal are making an already grave situation worse. And not in the last, keep updating your feed mill biosecurity plan. As said, feed biosecurity is an evolving concept that involves many people within a complex system, which is a feed mill. There are big returns in doing things right when it comes to biosecurity. Thank you for your attention, and I will be glad to take any questions, if any. Thank you.